Heart failure affects almost 5 million people in the United States alone. When you look at worldwide, that's about 15 million people that heart failure affects. But even more importantly than that, the United States healthcare system spends $30 billion treating these patients every year. And that includes those patients that are in and out of the hospital because of the symptoms they developed as a result of of the heart failure. One of the major causes of heart failure is an acute heart attack. Essentially what that means is when one of the blood vessels that actually supplies the wall of the heart gets blocked, it leads to an area of tissue that doesn't get enough oxygen. And when that happens, you get an area of dead tissue. Now surrounding that dead tissue is actually an area of cells that is on the border zone of dying. So when the heart tries to compensate for that decrease in cardiac function, those border zone cells see an increased amount of stress, and those cells actually also end up dying. Ultimately, over a period of months to years down the road, the heart continues to compensate for this decrease in cardiac function, and it starts dilating out to like a basketball. So what you're left with is a very thin-walled, weak heart that can't pump enough blood throughout the body as compared to a thick-walled normal heart. So once that stress is there, there's nothing there to relieve that stress. There's not a lot of treatment options that are offered early on to prevent patients from developing heart failure. Medications have been the mainstay of treatment. Unfortunately, medications have only delayed the onset of heart failure. During my surgical residency, I was looking for a unique opportunity to try and develop medical devices that would actually impact patients. In my search for an opportunity, I came across a program called the Biodesign Program, which is based in Stanford University. And I figured if I could actually develop those instruments, they could change the lives of thousands of people as opposed to a single person at a time. The heart actually sees an undue amount of stress on the wall of the heart following a heart attack. Based on this knowledge, we actually aim to develop a device that would allow us to reduce that wall stress in the short term and actually allow for any future cardiac reoperations or interventions as compared to other procedures that are currently available out there. You go to the cardiac catheterization lab and at that time have your angioplasty and stent placed to relieve the obstruction in the vessel. At the same time, through a small incision, you deliver a balloon around the heart. And what this balloon does is actually encases the heart and allows us to deliver a liquid polymer onto the surface of the heart. Now the natural beating of the heart will allow the polymer to distribute itself onto the surface of the heart. Once the polymer is distributed, it actually goes from being a liquid to being an elastic gel. And that elastic gel will allow for normal cardiac function, meaning that it would allow for the heart to function in the normal state. Now, at the same time, it will actually also aim to reduce the wall stress that the injured portions of the heart see. And it does that primarily by preventing the heart from dilating and expanding. And then after a period of about 6 months, which is what we have deemed to be the amount of support that the hearts need, the polymer actually starts degrading and is completely absorbed by the body. Now this is an important point because this will allow any future cardiac reoperations or interventions that the heart could possibly need in the near future. Currently, we're in the early stages of animal trial, and our small animal studies have shown this device to be successful. We expect to hopefully be on the market in the next 5 to 10 years.